Meeting properly noticed.
Yes, it was.
Everyone, as a reminder, turn your mic on. Roll call.
All members are present. Gordy is on Zoom.
And I have a motion to approve the agenda. Motion by Bob, second by Rick. Any discussion? All in favor? Opposed? Approved. Minutes of the July 10th meeting. Motion by Rick, second by Bob. Any discussion? All in favor?
Aye.
Aye.
Opposed? Minutes are approved. Is there any public participation? Seeing none. Correspondence? None. Okay, new business items for discussion and or action. Veteran Service Officers report from July, excuse me, yes, Josh?
Madam Chair, my screen isn't showing the agenda. Can we correct? Yeah. Will you please correct that? Thank you.
Yeah, we have Grabarski's thing on, which is probably not, should be shown.
Right there, Bob Gabarsky, right up there.
Yeah.
Yeah, Bob, you're collecting money.
Oh.
You can ask for donations too.
All the way back from 2019. Holy mackerel, Bob.
Yeah. We'll keep it up.
A little back pay there.
And that's it for my report.
Is it on it?
Is that coming off of mine?
There's no hyperlink for it. Oh. Okay, can we move on now? All right. Okay. Veteran Service Officers report. Rick, you want to step up here?
Yeah, hi Marge, board.
Hi
Uh,
there.
How you doing? We met with 52 veterans for the month. 335 phone calls and 463 faxes and transmittals. We did 8 outreaches for health and welfare and filing VA benefits. Just a couple of highlights. 10 Scott attended the CAT, the Rural Transportation Meeting and Support for Mental Health Community Action Team on the 10th. On the 20th, we had a virtual Wisconsin Department of Veterans Affairs for our monthly refresher training. On the 28th, I attended the Southwest Association County Service Meeting and hosted by Juneau County in Boston. On the 29th, Sauk County had the PACT Act, new presumptives for the toxic exposure thing at Ho Chunk for, I think, 9 to 2 o'clock. I attended that to support them. Other than that, that's the month of July. Any questions on my report?
Rick?
Yes?
Rick Pease has a
I have a
question.
question. When you always, every committee meeting, you always say you've met with so many veterans as
Mhm.
appointments.
Yep.
Is that 52 different people or is that?
Yep.
One
It's a
person?
combination. It's like a 3 or 4 phase process when we meet with veterans. The first initial visit, we go over whatever they want to file. If they don't have a diagnosis, we put an intent to file in. We explain to them that they have to go to the VA and get a diagnosis for their issues. And then once they get that, then they come in, we file a claim, and once that's filed, then if they get an award letter or disapproval, we have them come back in again and explain what they were awarded or disapproved for. And if we have to then file an appeal, if they want to fight why they were denied that claim, why that service connection claim was denied. And a lot of times before and after, we do a lot of research on their medical records to see if they didn't miss anything or if the doctors didn't miss anything. Yes, they're new ones, and yes, they're continuing for claims. So
Thank you.
you're welcome.
I have a question, Rich. This is Terry. My dad passed away and he was a veteran for Korean War and stuff, and he had a lot of great services through TOMA, through the VA in the town of Rome. Is there anything that he has to do, that we have to do to connect with anything? I had a person from church that said something about a bronze medal that could be on
Yep,
his.
bronze plaque for the grave. You just have to set up an appointment with Scott and come in. He handles all the deaths. And
I have to come in to Scott, because I
yeah,
thought that
you have to call.
Roseberry's does that, don't they?
What's that?
Roseberry's do any of that? That's
Well, it all depends on what they did. You usually send over the form verifying the DD 214. If you handle it through Roseberry's, they usually send us the document. Scott goes over it, make sure the DD 214 is there. We have to send it in from this office to the VA
okay, so it should be covered through Roseberry's.
and us. Okay.
Thank you.
And what's your last name? What was your dad's last name? Can we give it over or just give me a call?
Yeah, no, Koba, Kouba.
And you guys haven't worked with Scott Lowry, my assistant.
Okay, I have not worked with him at all.
Okay, he's off this week, so he'll be back in next week. So we just need to get a hold of you, or you just call us and let us know what you've done, and we'll work offline on that, okay? There's a lot of stuff we just have to look at to make sure everything is correct, okay?
Okay, thank you.
You're welcome.
Are there any other questions? Oh, Bob,
Rich,
go ahead.
this is Bob.
Hey, Bob.
Just a follow-up on Pease's question. Are denials somewhat common?
Yep,
The reason I asked that, I mean, the insurance companies seem to have a picnic with that, and I was wondering if the VA is similar.
sure they are. I'm just gonna let you know. They do a lot of peculiar things that are very frustrating right now. I can apply for an increase on one, and then they turn around, they give an increase on that, and then they can decrease on another that keeps that veteran at his service connected level, so he doesn't get an increase in pay. I've had 4 that's happened this year on, and I've had to resubmit claims to get them what they're supposed to be awarded. So it's just making my job here 2 to 3 times more than what it should be. So
So on a follow-up, what's your success rate on getting those things the way you think they should be, at least?
my rate, how I think it's going, I don't have.
My question was, will they conform when it's denied the first time? Will they accept?
No, I've had, it's a 3-phase thing. We submit a claim. If they denied, then we go to they call it a supplemental claim. I submit it for a higher level review. That higher level review sides with the rater that's already denied it. They continue to deny it. Now I have to send it to the Board of Veterans Appeals, which takes another 365 days for the board to even review it. And if the board reviews it and says, hey, we remand it back down to senior rater because we're not going to do their job, senior rater do your job, and then they finally award it. So how it's working now, all of our claims, 75% of our claims are going out throughout the nation. Okay. When I started here in 2014 to 2017, all of our claims went to Midwest to Milwaukee. We're getting our claims done within 3 to 6 months, and they're all coming back usually favorable. The VA said, wait a second, Midwest region, what's going on here? Why are you getting such favorable findings? they thought it wasn't fair, so they said, guess what, Midwest, you only getting 25% of the Midwest claims, 75% are being farmed out to the nation. God forbid if any of our claims go to Waco, Texas, or out to Oregon, because we don't see them for over a year, and there's nothing I can do here to fight it.
Maybe apply for those through the Ukraine.
What's that?
It was a smart answer.
Just
Yeah,
as-
I know. I'm about ready to volunteer to go over there. That's it's worse than fighting the VA, you know? It's very frustrating right now, Bob.
Thanks.
You're welcome.
Supervisor Pease.
You know, we listened to Keith Van Orton come and talked about VAs and how high in priority them. Maybe you should explain that to his office and see what they could do.
I forgot, well, that's on for next month for August. I was just at the Toma VA Congressional CVSO liaison meeting. There's Tammy Baldwin's representative there. No, it was Ron Johnson's. Yeah, Tammy Baldwin, I think was there. I think she was online. And there's 3 representatives there. And right now we're finding out that the VA in Toma, Wisconsin will not diagnose our veterans right now with the new PACT Act because they feel it's not their job to do competent examinations. We understand that. Their job is to just diagnose. If they diagnose, then the veteran can come back to our office. I can turn around and I can file a claim because I cannot file a claim unless it's diagnosed. So that's the problem we're having right now. Tammy Baldwin, all the offices, congressional offices understand the situation, and it's an ongoing struggle right now. And that's holding up a lot of veterans' claims.
Josh.
Madam Chair, my question is for Rick. Rick, were you
Mhm.
referring to Derek Van Orden? Yeah. Oh, okay, thank you. Just wanted to clarify that.
Yeah.
Okay. Moving on, your financial report, please, Rich.
Yep.
Does anyone have any questions on that? Seeing none. We thank you.
Thank you.
And have a good month.
Yeah, we're in try here with this new PACT Act issue. All right,
Yeah.
thank you. All right.
Okay, next on the agenda is to review the June 23rd Health and Human Services Department Financial Report. And who's doing that? Kyle or?
Wendy, do you have anything you want to update in the report?
No, I do not. We're still have a positive fund balance, so we're still holding our own for the year.
Does anyone have any questions of Wendy? Seeing none, thank you, Wendy.
Hold on.
Okay, Kelly,
Are there any questions for the director's report or manager narratives for this month?
Supervisor Grabarski.
Yeah, this one's for Donna, I guess. The vans and so forth that are being replaced from when, 2021? I just an update, I guess, is all I'm asking for.
Yeah,
I did push it. Yes, these are replacement vans, but from like 2011, and there was a chart last time. So these are older vans that these newer vans are replacing.
So we had applied for them back in 2021.
Mhm.
We're just finally getting it.
One of the dates on the van is correct, is incorrect, I think. You got a 2022, did you just not receive it?
Yeah, we applied for them in 2021 for the 2022, and we just received it in 2023.
2022 arrived on, yeah, it said it arrived on July 27th, 2022.
2023.
Yeah, if you look on your sheet there, it's-
Donna's off a year.
Yeah, I'm off a year.
We're gonna welcome her into 2023. Yeah.
just caught a little L. That's okay.
This ban took well over a year to arrive.
Right.
That was
Yeah,
the
Waiting
challenge.
for it, right?
And we still have one van out there that we're waiting for too. So we're expecting that one in the end of this year or beginning of next year in January. So
Has anybody proposed possibly picking up seniors for restaurants to get them out?
oh yeah, we pick up people, seniors for restaurants if they wanna. If they call for a ride, we do non-medical rides now. So if they want to go to a restaurant or get their hair done or things like that.
Oh,
Within reason, within our ability.
Right, and there is a fee for that. There's always a copay, so for van rides, so.
just planning ahead, just planning ahead.
Okay.
Josh,
Madam Chair, motion to correct that, the 2023 error.
We will, how about we reread this and
Right,
double check the numbers
Yeah.
and we will correct it in next month's narrative. Does that work for you?
Well, let me just correct it, motion to correct it now. We should probably establish that in the meeting right now, I imagine.
I don't believe we need a motion to do that.
Okay, can we just,
It's Kelly's already offered to doubt
okay,
and change it and bring it back next month.
all right, thank you.
check that.
I have a question for Corey. How's your public health staffing doing considering we're going into the flu and increased COVIDs?
Right now, public health is doing all right. I know that they're talking about a increased flu season. We already started our public health planning for the flu season. We put a strategic plan put together. We're working with the school district, the community, the county here, the courthouse, and then along with the school district to kind of get a plan put together and the assisted living. So, but we do have a strategic plan put together and we should be getting our vaccine in September, maybe late September, and then we'll start getting those plans pushed out. So.
Josh,
Madam Chair, my question is for Cody. Why are they anticipating an increased flu season? I haven't heard anything about that yet, so please.
So the experts of the CDC are just expecting increased flu season with RSV, COVID and the flu. They're just anticipating a spike to come through this year.
Okay, all right, well, hopefully that doesn't come true. Thanks.
anybody else?
Yeah, I have a question on the dental care. Many students of my past do not have teeth right now because they hadn't had sealants in the past years and stuff. And so I'm noticing something that was on the thing about dental care with the sealants.
Yeah, I can answer that. So with Public Health Access to Care Community Action Team, which came out of our community health improvement plan, we developed a dental care with family health, La Clinica. So we utilize their mobile dental unit a couple times a year. And they were able to come to the school district along with the behavioral health center here in Adams County to offer a lot of services for dental care, which in return helps with mental health too, and just overall confidence. So we are very fortunate to have them a part of our community action team for access to care, and they're going to continue offering mobile dental unit care once the farming season is done. And then they'll also be having a physician assistant come on their mobile unit this month as well in August to offer sports physicals in return to offer more patient care in the future with that dental unit and doctor unit. So
How accessible is that for everybody there in Adams County?
there's a lot of locations being looked at, from the mid-state location to the school district location and the behavioral health here in Adams County. So there's 3 locations right now, but we set everything up through Public Health and La Clinica, and then we're able to get them to come to those locations and provide them with the care.
Did this happen last year too? or since the COVID season?
So this started just in the beginning of 2023, January, February, and March.
Okay, so
there-
you have written down that was 2021 community health assessment was access to care.
Yep. So in 2021, we completed our community health assessment, and those top 4 priority areas that came out were one of them was access to care. And then after we developed the community health improvement plan, the CHIP, which comes from the CHA, the community health assessment, that access to care was developed. So that work group with the community action team developed some goals and strategic planning around that, which included dental care.
Thank you.
Josh?
Madam Chair, my question is for Cody. Cody, I'm aware with adults with the Clinica, they're only able to get one procedure at a time, meaning if they have multiple cavities, they can only get one done, then they have to come back again. And then if they miss an appointment, there's some kind of, they lose that service. Now, it seems somewhat inhumane. Sometimes people have to wait so long for these procedures. I know if I have a cavity or something like that, I want it handled immediately. Or a tooth that needs to be pulled, I'd like it to be pulled immediately. It seems like there's quite a waiting list with adults. Now, is the same true with the children with this mobile unit? Do they only provide one service at a time and then they have to wait again for like a cleaning, or it just seems horribly inefficient?
Nope, they provide an initial assessment, so they'll set up an appointment with public health. We'll communicate that with Family Health La Clinica. We communicate the dates when the mobile unit is coming. They'll start the initial assessment. So whether they need cavities filled, maybe sealants, or even maybe some teeth pulled, they'll set up that assessment after that initial assessment to get that work taken care of. So it's a step system, but it's all taken care of in a quick amount of time.
Okay, so to be fair, it sounds like this is better than what they provide with the adults
I,
at La Clinica
I think what
as
I
far
would
as
say
services.
is that dental care primarily for people who are uninsured or have Medicaid. It is a very challenging service to find a dental provider to take Medicaid in particular.
Mhm.
We are very fortunate to be able to get the care that we're able to get from La Clinica coming in. And one of the reasons it is in the community action team is to try to bring in as much dental care as possible so that we can continue, or they can help fill that gap so there isn't a long wait like there is.
Mhm.
But we are well aware, this is a problem well across the state and the nation,
Mhm.
that dental care is hard to access.
No, that the centers, there's 2 of them, is that right? There's not one within the county, but it's over in Boston. There's a La Clinica, is that where they
There's
could?
a La
No.
Clinica dental
then-
unit in
and-
Boston, and also they have a dental unit in Watoma. And
Right.
then now the mobile clinic is coming occasionally to the Adams County area.
And but is that gonna be available to adults as well, or is that just for the
That's
children
fine.
at the school? I mean,
Yeah, it's
Everybody-
it's available to anyone in the county. They all have access to it. They just need to set up the appointment. And whether they're insured or underinsured, there's usually a slight sliding fee with that.
mhm. Okay,
Perhaps we could ask La Clinica to come and discuss some of their services at one of our meetings, if that would be helpful.
yeah, I just, it seems like there could be a more efficient, well, more humane way. So there wasn't so much of a waiting time for the adults especially. I mean.
Yeah, and
have a
maybe some,
cavity and sitting with it for a month or 2 or even longer, it seems pretty extreme. So,
and maybe some PR to come out to let people know somehow, some way about this service.
Yeah, we typically post on socials, the newspaper and radio, but we can get more postings out for the community.
yeah, I think that would be good as well. So thanks for all that, Cody, Kelly.
Thank you.
Thank you, Cody, for your report. Yeah, okay, is there any other questions from anyone? We'll move on to the project status report then.
A project status report is pretty status quo, I'll say. We're kind of just holding steady with our projects right now.
Supervisor Peasy.
We gotta talk about, ARPA funds that were being used for truancy.
Mhm.
Do you have an update on that? If we're gonna hire somebody again or what's going on with that?
My understanding is the funds will be expended by the end of this year, the end of 2023, I believe. I'd have to look at I'm looking at Kyle. But one of the things we're in the process of is we are applying for another grant, the Brighter Futures Initiative, and hoping that it can be a little bit broader and fold in some of the successful services that was a part of that program.
So you're saying you're basically running out of the funds, correct?
Yes, we will run out of the funds.
Out of the ARPA funds?
Yes,
Okay.
and the other grant that was assisting with it has ended.
Okay, thank you.
Kelly, could you move the mic a little closer when you talk? Hello,
I'm ready.
thank you.
Madam Chair.
Okay. Excuse me. Report of community members Coordinated Services Advisory Committee.
Diane, can you provide an update on that?
Yes, I can. We had our meeting on July 11th. Some of the topics that we went over was our need for additional members to replace members that have either passed away or moved out of the area. So any recommendations would be appreciated from the committee. We also went over our 2022 survey results with the committee, which were included in our annual report. And we also talked about redoing our interagency agreements with our stakeholders.
Are there any questions? I'll add a report here. The Aging Committee met last week. And I'd like to say a big thank you to Sarah Manning for doing an excellent job last week under pressure within the department. Apparently she came in Monday to a refrigerator that wasn't working because of the storm on that Friday night. The drivers have helped out by filling in. And then Sarah Manning from Practical Sense had some of her staff volunteers come over to help the drivers by being runners for delivery of meals at their home sites. I think all of these staff deserve a thank you. And it shows what our staff in Adams County does by working together.
Yeah, it was really appreciative. I was on vacation, so having Sarah really kind of handle the situation with the freezer going out, and Bill coming right over and everybody working together to make sure that it wasn't a loss of any kind of frozen foods. And the volunteers picked up extra routes for Sarah, and Sherry Manning over at Practical Sense really helped out with sending us some runners. So thank you for saying that, Marge.
Thank you, Marge.
Josh?
And Madam Chair, it sounds like they caught it before the food spoiled, so that was all no loss. That's good to hear. Thank you.
Okay. What do we? Okay, the Aging ADRC Senior Nutrition Program Review.
So I just wanted to, I think I was asked to just talk about our dining sites for our nutrition program right now. And I just wanted to make sure that people understand our senior dining sites right now is a restaurant and the congregate site. But the reason for senior dining sites is to provide a place for socialization, to provide a meal choice, nutrition education. We are required to have 5 days per week between the sites. And we have to provide nutrition meals that are approved by a registered dietitian. And I also wanted to really emphasize the fact that senior dining sites is a priority in a nutrition program. We cannot do home delivered meals without having senior dining sites. So it's really important that we keep those senior dining sites up. Home delivered meals is kind of secondary to helping people get back to a healthy condition so that they can come to our dining sites. Right now, we have the Adams Community Center dining site, which is a congregate meal site. And it's serving 15 to 25 meals Monday through Thursday. And then we have Roxy's Country Skillet, which is a restaurant style dining site, and they're currently doing 30 to 40 meals Tuesday through Friday. And right now, the Title B, we get grant funding, which is around C1, which is 96,154. That's our grant dollars for that. And then we asked for a suggested donation amount of $4 per meal. And that's off. So the year to date is 18 from till June. As of this year, we collected from January to June, 18,548. The community center was around 5,507, while the restaurant was 13,041. So just to make sure that you're aware that the suggested donation amount is $4. That's what the state recommends that we say, but people can come and eat at a dining site, and we're not to ask who pays. We don't know who pays. We just ask for that suggested donation amount, and then some people pay more, some people don't pay anything. It's really up to them. So that's how the donation works. We ask for the $4, but it's really up to them. The average cost of a meal at the community center is around $13 to prepare. The average cost at the restaurant that they're charging us is $10.50 per meal, but the contract says they cannot charge us more than 12. So in actuality, they're charging us less than what the contract even says. So they charge us per meal per month, and then through the contract, we pay them what they charge us. So it's actually very easy to keep track of versus sometimes the community meals with people's salaries, with the raw cost foods, with the delivery charges, with different things. It varies so much. It's much harder to keep track of. Restaurant sales, much easier to keep track of the cost. That is about what the only other, and Kelly, you want to mention this, but we are looking at other things to do to keep the restaurant style has worked really well for us for efficiency and so forth. And we're looking at other things to do to help keep our costs under control. And right now we're putting out, and you may see this, so we want to just make you aware of this. We're putting out requests for proposals for catering services to help us with home delivered meals to help keep some of the costs down, but yet still provide the quality. And we want to be able to serve a lot more people in Adams County, and we're struggling with with our staff and so forth right now. So we really are looking at other ways to expand services, keep the quality and the efficiency going. So you'll probably see that coming out soon.
Madam Chairman. Yeah, so you were kind of alluding to what I was going to ask, but how can we bring more awareness to this service? Because I've noticed a lot of elderly folks that aren't getting this service, you know, and they don't have the ability to go drive, or they might not be able to see very well. So we'd like to see the services, you know, getting and reaching these folks. So I'm just looking at better ways that we can make this more aware to the public.
Yeah, that's always the marketing is always, you know, a huge, like with all of our programs. We advertise in the newspaper, we put news releases out, we give the advocate out, we mail the advocate out to a lot of different people. We go on the radio once a month. We talk about these programs quite a bit. So yeah, we would love to get it out to everybody, you know, who qualifies a meal to them, home delivered, or get them to come to the dining sites. But we are getting, you know, if we could go door to door, we would, but we just don't have the ability to do that.
I wonder about reaching out to the town board.
Yeah, we've
the
given,
town boards
we've
and,
given, presentations to town boards and so forth, and we can do that again.
Mhm.
Usually we have to be put on their agenda and asked to come, but we would do that.
Okay.
I don't mind talking in front of the town boards at all.
Yeah, we'd like to have you come to Newchester. if
Knew
you
you were
would.
gonna say that.
So you're welcome to come. I think our next meeting's next Monday night at 7 there at the community center. So I'd like to invite you if you'd
Oh,
like
it's
to.
at the community center?
Yeah, in
Oh,
Grand
I can
Marsh.
do that.
Yeah, so
I
Donna,
have
how,
it on the agenda.
Donna, how many sites are there available in the, in the county of Adams as far as any nutrition sites?
Well, availability, for dining sites, we've tried the town halls, we've tried some of the different churches and so forth. But, it's getting community members to come and be consistent, so. Right now, we have two, the Adams County and the restaurant style.
Okay, so after the COVID and stuff, a lot of them failed. Or during the COVID and stuff, didn't have any more. Are we gonna ever try coming back? I'm just looking at the town of Rome and,
Donna, do you want to talk about some of the changes with the program as far as the staffing requirements now also?
Yes, that has been, and even before COVID, we were struggling with getting people to come to these sites. So it's not just a COVID issue, but, and this is not just Adams County, this is across the state as well, getting people to come to the dining sites. But we are mandated to have a dining site manager at every site. So dining site managers have to be there to make sure the food is being served appropriately and they make sure that things are, people are staying safe, basically. So we just don't have the staff being to go to all of these different sites as well, to be site managers. And that was a newer change that they have to be paid staff now, not just volunteers. And so we just literally don't have the staff to man all of these, sites that we would like to start up again, so.
I would just add the funding for these programs is not significant.
Right.
So to be able to provide a quality level of service, we have to be able to manage what we have. And until the state increases some of those revenue sources, we're not able to have a super robust program.
For example, the home delivered meals, the state the state is provided $399,000 for all home delivered meals in the state for these programs. The request was made to the state recently to increase that amount to 5.1 million. But the state was generous to give us $250,000 more. So that's across the state. So these programs are very funded, just very minimally. And so we have to keep that in mind as well.
thank you.
Madam Chair, I was just wondering what the county is budgeted for this program here in Adams.
I think that's a great question. I'm pretty sure we had that on a slide a few months ago when we talked about the nutrition program. Let me see if I can pull that slide and we'll share it with you.
Okay.
Okay.
Yeah, we worked out the numbers then.
Okay, well, we're looking forward to getting those. Yeah. Thanks, Kelly.
All right, I had brought this up to Marge because a couple of things. Roxy's site there, Country Skillet, seems to have been highly successful, a lot more successful than I ever anticipated, and good for them. That being said, I could see where other sites would be interested in doing that. What was hard for me to comprehend was the fact that it brought in so much more business, not just seniors, but others as well. And then also with this type of suggested price, I have seen, and I don't go there regularly at all, but I have been there probably half a dozen times. And the tips are better, simply because they're paying less for meals and they're more generous with tips to the wait staff and compliments to them. Two other things. One is, rather than a suggested $4, and we're someone would typically round it up to 5 or 10 as a couple or whatever. Could we be somewhere like at suggested $6 where they might round it up to 15 for a couple or something like that? That's one question. And then the other one I forgot. Oh, so there's no bill issued, so you just donate on your way out or whatever. And my question would be, has that little box, it's awful handy to come by it and slide it into a purse or something. Has that ever left? Is that, it hasn't?
No,
Wonderful.
the donation box is picked up every single day by,
But even so, I mean, as you walk by it, it's so close to someone walking by. I mean, it would seem like they could move it back a little bit where they at least have to reach for it if they was.
well, that's up to the restaurant where they're keeping the donation box. And as long as we've had no issues with somebody taking it, and we have not, I think it's been fine. It's worked out really well. Plus, people have short arms and they just want to be able to stick it in. So, no, that we have not had any issues with that at all. Now, the donation price, the reason we use $4 is that's suggested by the state that we use that, but we would have to do that for the community site as well, the Adams County. We have to keep that price the same. And so I'm not sure if we would, $4 is pretty good. When we raised it from $3 to $3.50, it was really bad. And then getting up to $4, people have a really hard time with that. So I think 4 is what we're gonna stick with at this point. Yeah, people had an issue with a suggested donation rate of $4, an increase to $4 from $3.50.
I think one of the things we could do is look at our surrounding programs surrounding us and see what their donation price is. And we could take a look at that.
And we have done that, and we're right in the ballpark with
Right.
everyone else, so.
And I don't want to belittle that theory or anything, but if you go across the Subway or you go across the McDonald's, you're not going to buy a meal at McDonald's for probably much under $10 anymore.
Well, the point of these senior nutrition programs is to get people eating a nutritious meal, whether they can afford it or not. So it's not so much about the cost to the program. It's more about getting
Good point.
people into eating a nutrition program. And so they don't want the cost to be prohibited to that.
But Donna,
I understand, Bob, but there's a lot of people who will pay more and some people who just want a free meal. And that's what they're gonna get. And we don't get to choose which person that is.
Plus, a lot of people don't have money either. I mean, they don't. So I remember buying my dad the Meals on Wheels and he would say, how much are you paying for that? I says, it's okay, everything's covered.
Okay, thank you for the information. We will move on now to our public health.
So coming up in a couple Saturdays from now, Public Health has their annual suicide prevention walk, run, and bike ride. The participants can choose from a 1.5 mile walk, a 5 mile bike ride, or an AK fun run. This event, as always, aims to reduce stigma surrounding suicide and promote the resources that are available in the community. Those that are interested can sign up online. They have until September 4th. Otherwise, there's a same day registration as well. The event also includes raffle prizes and silent auction items. The event is free and all the money raised goes directly back into the community to support mental health, suicide prevention activities. We have been getting a lot of sponsors and sponsorships. I want to take the time to thank those sponsors too for their continued support for Adams County and mental health and suicide prevention. And again, this event is used to eliminate and reduce the stigma surrounding suicide and promote the resources that are available in the community for mental health and suicide.
Madam Chair, my question is for Cody, if I may. Cody, can you tell us more about where these proceeds or who's getting those or where these are going? It just wasn't clear.
Yep. Yeah, so the donations come to Adams County Public Health. They can be used for a lot of our mental health and public health priority areas. We also use them for evidence-based programs and practices. So that's kind of what we use those funds for. A lot of it is for prevention measures in the county and community.
Mhm. Do these funds go to the Gunderson Clinic as well? Is that some of where these proceeds would be going or?
The donations get directly donated to Adams County Public Health, but in collaboration, we might collaborate with Gunderson to use those funds for something for out in the community or in the county.
So they do go to Gunderson and ultimately somehow?
Yeah, it's a collaboration. So
Yeah.
if there's something that we want to link up for together, we could potentially use those funds.
Okay. One more question, Cody, related to Gunderson. Why might it be that at the Gunderson Emergency Clinic, suicidal crisis patients are told that no services are provided and crisis patients are sent home that may be suicidal? And it's basically, there's a wall there. So why is that, why does that happen?
And that should be directed to Gunderson, not to our public health officer. That's Gunderson's
Okay,
policy. Direct it to
okay,
them.
Madam Chair, how can we get somebody from Gunderson here to answer my question, please?
I'm not sure if that would be appropriate for them to come.
Josh,
Hmm.
Dr. Long,
Yeah, go ahead.
I'm a Gunderson physician.
Hmm.
What you're saying
Can you
is
tell us why
not-
that might be there, doctor?
Pardon me?
Can you tell us why that might be? Please.
Well, I don't think your information is 100% correct.
Well, I was told by a
Let me
very
f-
credible source and have had
Are you gonna let me
multiple.
finish?
Go ahead, doctor.
Thank you. Recently, the emergency room at Gunderson has hired on a telepsychiatry staff with using telemedicine. So if patients come into the emergency room with let's say suicidal ideation, homicidal ideation, they can 24/7 access the appropriate psychiatrist or psychologist, work with them on the case, present the situation. The telepsychiatrist can actually talk with the patient. And then decisions can be made as to what the next step will be.
So this is done through Zoom and it's not done in person, is that right?
That is correct.
So we lose a lot of communication when this takes place. How can we be sure that?
So what you're saying is there should be a psychiatrist on staff in the emergency room?
Well, I'm not saying there should be, but maybe
That's what you're
why,
saying.
my question is, why isn't there? Can you tell us why there's not, please?
I really don't think, with all due respect, that there's enough psychiatrists to man every small, medium, or large emergency room.
Is there a psychiatrist available in the county, period, for that matter?
Kaiser Kozlowski.
Now you're expanding your question. You had a
Oh, you're opening the door.
regarding,
This is a door that needs to be opened, I might add, very badly, because I happen to have a lot of contact with our people here in the community. And I know
I
better than
respect
what you're
that.
telling me.
I respect that. You had a question. I answered the specific question. If you want to expand upon that, I agree with you. We need a lot more of mental health services. But in the meantime, we asked a question, it was answered.
Okay, so how can we be sure that they're not being sent home in the future? If somebody's having a suicidal crisis, how can we be sure that that person is not being sent home and their services provided to them here in the county immediately?
My,
An answer, Josh, asked and answered.
I guess we're kind of off the Adams County Suicide Prevention Walk, Run and Ride at this point. Could we get back? on
Yes,
topic?
we are. We will get back on point. Cody, is there anything else?
I just wanted to add, it's a very positive event for our county and community, and I want to thank all the event staff and my health specialist and the key community stakeholders for putting this event on. And I'm looking forward to the future and the future walks to continue. Thank you.
We wish you well on your walk and thank you, Dr. Long, for your response. We appreciate your participating in today's meeting. Supervisor Kozlowski, was there something else you wanted to?
Yeah, I'm just
add?
wondering, can you tell us more about how the suicide prevention works or what they're doing?
We've already covered all of this. He's talking about a walk.
Right, very well, Madam Chair.
Moving on, our next meeting date is September 11th. Is there anything further to come before this committee? Seeing nothing, we are adjourned. Thank you all.